Hi everyone, good afternoon. I'm Dr. Calvin Martinez. I'm an ophthalmology resident doctor here in Cebu Bellas General Hospital. I'd like to welcome everyone to our short lecture and discussion today. So we decided to do this online lecture to be able to inform our viewers of common eye diseases that we encounter at our clinic. Usually we do this forum at the outpatient department in Bellas Hospital, but due to the COVID pandemic, we will be doing this online. So I'll be discussing briefly on some common eye problems that we encounter in the clinic, and then I will highlight on certain conditions that require more immediate medical attention. After the lecture, there will also be a question and answer portion. So if you have any questions, you may type them in the comment section below, and we will answer you. So to begin, let's first briefly discuss on some basics of the eye, so the anatomy of the eye. So this picture on the left is a cross-section of the eye. The front part of the eye is your cornea, or tawag nato sa Binisaya, ang samin-samin sa mata, no? So this is the clear visible part of the eye, and this is where your light enters. So the cornea functions like the crystal of the watch. Then light enters through the anterior chamber of the eye, the pupil of the eye, or ang taw-taw sa mata, and then the lens. So here is the lens, which also has to be clear. But the lens, however, as we grow older, it becomes less clear, it opacifies and becomes your cataract. Kaning cataract ato po ni discuss later, no? And then behind the lens is the gel, or the gel-like substance of the eye, which we call the vitreous. And then behind it is your retina, or what we call ang plaka sa mata. So the retina is the film of the eye. On the right is another picture of the retina, no? This is the retina, this is the center of the retina, which is what we call the macula, and this is your optic nerve, or ugat principal. The retina is made up of millions of neurons which transmit light to the brain through the optic nerve, or tawag natong ugat principal. So how does the eye work? So for us to see clearly, light has to pass through several structures before it reaches the retina. So light passes again through the cornea, the anterior chamber of the eye, ang pupil, or ang taw-taw sa mata, and then the lens, ang lente sa mata, and then the gel of the eye, or the vitreous, and then your retina. So the retina then sends the electrical impulses through the optic nerve, or ugat principal, to the brain so we can see. All these structures from the cornea to the retina, dapat tinaw ni siya. They all have to be clear. If there is anything obstructing the passage of light through these structures, then we have your blurring of vision. So now that we discuss some basics of the eye, let's go to our common eye problems in our clinic. So first is your refractive errors, or kanang grado sa mata. So I'm sure all of you are familiar with the terms nearsightedness or farsightedness, astigmatism. So unsa man ni siya? This is what we call your refractive errors. So types of refractive errors, we have your myopia, or your nearsightedness, your hyperopia, or farsightedness, and your astigmatism. So refractive errors are caused by the differences in the length of the eye, kung unsa ka taas ang atong mata, and the curvature of the cornea, or the shape sa atong samin-samin sa mata. When light enters the eye, they have to be bent in such a way that these light rays are focused on the center of the retina, or the macula. So in patients who are myopic or nearsighted, these light rays are focused in front of the macula, or atubangan sa macula. In patients who are hyperopic, light rays are focused behind the macula. And in astigmatism, the shape of the cornea causes the light rays to be refracted or bent in different positions, in different planes. So in all three cases, these result in your blurring of vision. Thankfully, majority of these patients can be treated just with your glasses or contact lenses. So these instruments help or assist the eye to focus the light light rays on the macula. So we have very many different types of your glasses. I'm sure many of you are familiar with this. The purpose of these glasses is to focus light rays onto the center of the retina or your macula. So it's very important to note and understand that if your vision doesn't improve with your glasses, then you should go see an eye doctor so that you can have either you need to have your glasses updated, or there could be a more serious problem with your eye. Next is your cataract. So, kaning cataract, no, common kayo ni siya na sakit that we encounter, and I'm sure almost all of you have heard about this eye problem. So what is a cataract? So a cataract is the opacification or darkening of the lens. Again, kaning lens, kailangan tinaw ni siya. So ang kaning cataract is when the lens is no longer clear. So if you recall again how the eye works, light has to pass through the lens before it reaches the retina. So kung dili na tinaw ang lente sa mata, then natay blurring of vision or muhanap atong pananaw. Okay, cataracts usually occur in the older age group, kanang mga senior or kanang mas tiguang. However, this can happen in the younger population, even in pediatric patients. However, usually this is it's more common in the older population. So, unsaon pagtambalan ng cataract? Unfortunately, cataracts are not treated with medications or your eye drops. No, di siya matambalan ng pagpatulo ang cataract, kailangan ni siya operahan. Okay, so ang buhatong aning operasyon is to remove the lens and to put in a clear artificial lens inside the eye, sama ni ining picture, so as to restore the vision of the patient. Your cataract surgery is a very common procedure done in the hospital or in different eye centers, no? Kaning cataract surgery na atong gisuryaan is not your laser. So I'm sure daghan ninyo nakadungog kanang cataract surgery kay laser sa mata, no? That's different. Lahi na ang laser na surgery sa mata. Ang kaning cataract surgery, kay what we do is mo sulod mig instrumento sa sulod sa mata, unya pulpugon ng cataract sa sulod, sa yupon, unya magbutang mig artificial lens sa sulod sa mata, no? Some cataracts na kanang mas baga na, mas hinog na ang cataract, they require a larger one, mas dako na samad, or different other instruments. However, it's the same principle. So, tangtangon ng cataract, butangan na itong artificial lens. Cataract surgeries are not an emergency usually, no? So, it's not like ma-diagnose ka na nakay cataract, operahan dayon ka right away. So, however, it's also not advised to wait for a very long time. Or kanang, I'm sure a lot of you have heard kanang pahinugod og maayo ang cataract, or we wait na hanap na kaing pananaw diha pa magpa-opera sa cataract. So that's one wrong misconception, no? So again, if your vision is blurry despite you wearing your glasses, it's best to have your eye doctor to give you a check-up. If they see na naadyo kay cataract, they give you a full examination, i-examine ka og maayo sa doctor to make sure that walay lain problema sa mata that can also cause your visual problems, and then they will discuss to you your options and or how to go about your cataract surgery. So next, another common eye problem that we encounter also, which is very common, no, here in the Philippines, is your pterygium. So kani muning picture sa atong pterygium here on the left side. So ang kaning pterygium is a triangular fleshy mass of conjunctiva that slowly grows and covers the cornea. Okay, so ang pterygiums don't normally cause blurring of vision. Kung gamay pa siya, dili ra mo hanap imong pananaw. However, if mudako ni siya maayo at matabona na ang sentro sa minsan sa mata, matabona ning taw-taw sa mata, it can cause your blurring of vision. Also, pterygiums can also create astigmatism, no? Mulahi man ang shape sa imong cornea, that's why it can cause some astigmatism. Kaning pterygium is very common here in the Philippines because we're a tropical country. So factors that can cause your pterygium are your prolonged sun exposure, kanang pirmi mainitan, maabugan, hanginan, no? It usually starts very small kanang diri sa kilid sa mata, and then makabantay ka that it slowly becomes bigger, and eventually it covers the cornea kung dako na kay siya. So unsaan pagtambal ning pterygium? Kung gamay ra kayo ang pterygium and it's not causing any problems, we can usually just observe, no? Atong obserbahan, taga na tog mga lubricant, eye lubricants to avoid. Also, we instruct the patient to avoid prolonged sun exposure, no? Ang abog, dust, give them protective eyewear, mga sunglasses. However, kung dako-dako na ni siya, we need to do surgery. We need to remove the pterygium. So, operahan ni siya, ang tangon ng pterygium, no? Depending kung unsa na technique of surgery buhaton, it usually takes around 30 minutes to 1 hour ang surgery. Niya tagaan na yun ang pasyente og tambal after the surgery. So that's your pterygium. Next, let's go to your conjunctivitis, no? Kaning conjunctivitis or is what we call your piscat. And daghan kay klaseng conjunctivitis. Let's just discuss on the most common, no? Kaning viral conjunctivitis or atong tawag na piscat. So I'm sure all of us are familiar with this. So kaning piscat is a viral infection of the conjunctiva. So sa maning conjunctiva. So ang conjunctiva is kani kung tananin mo akong mouse. The conjunctiva is the inner layer of the eyelid. So kung muna itong eyelid, ang inner layer ang the innermost layer of this structure is your conjunctiva. Unya, ang kaning nagtabon sa puti sa mata nato, there's also conjunctival tissue here. Okay? So ang kaning muna atong samin-samin sa mata, ang kaning puti sa mata is what we call your sclera. The sclera is covered with your conjunctiva. Yeah. This is continuous with your conjunctiva of the eyelid. So, ang kaning viral conjunctivitis or piscat is a viral infection of the conjunctiva. So, usually this condition affects both eyes. No, the patient usually experiences eye redness, magmuta-muta, especially in the morning, kunya magluha-luha, kunya katulsa ng mata. Important also na to remember usually kaning piscat, it's usually both eyes ang ma-affected ani. However, it's important to remember, no, kaning piscat doesn't really cause blurring of vision or eye pain. So dili ni siya sakit, sambo lang. Okay, and dili rasad kay muhanap ang pananaw. It just causes your eye discomfort, tearing, redness. Okay, so if you experience this, if you experience any eye pain, your blurring of vision, kanang muhanap ng pananaw, most likely dili na siya piscat. So in this case, you should go see an eye doctor when you can. How do we treat viral conjunctivitis or your kaning piscat? So usually we just give eye lubricants, mga artificial tears. Kaning piscat is very contagious, so makatakod gini siya. So it's very important to wash your hands regularly, unya dispose of the tissue that we use properly. And then we usually advise the patient to rest for a few days, di sa mo trabaho or mo eskwela, kay it's very contagious. Piscat usually resolves over time with no complications. Now we just have to give medications to help with the symptoms of your piscat. Sunod, ato sa chemical injuries. Kani mga chemical injury, this is an emergency, this is an ophthalmologic emergency. And this is also pretty common here in the Philippines. So kaning chemical injury sa mata is an emergency. So examples aning chemical injuries are kaning mga battery acid, mga super glue, shoe glue, mga detergent or kanang paggamit paglimpyo sa CR. Chemical injuries vary depending on the type of chemical and the amount that gets into the eye. So kung daghan kay na suds mata, mas grabe po ang damage, or kung gamay ra, mas gamay ra sad. Depend po na siya kung unsa na type of chemical na isud sa mata, no? So sometimes it can cause only very mild injuries. So some na ilang defect ang conjunctiva or the cornea, which will eventually heal, but in certain severe cases, it can cause far more damage and even blindness. So if naanin nyo, who had the unfortunate accident of a chemical injury to the eye, or if na may kaila or trabahante na aksidente, it's important that you go to see an eye doctor right away. So what we do, we usually irrigate or bubuan na mong tubig ang mata, okay? So, and then after that, we examine the eye to assess for the damage, and then we give your medications. You can also do the irrigation or flushing of your eye with running water while waiting, but you should go see an eye doctor so the doctor can assess the damage and give you the appropriate medications, no? So muna imong chemical injury. Sunod, ay napaday tayo line picture sa chemical injury. Sunod, ang kanimong foreign body. So unsa man yung mga foreign body, kaning mapuling. So common mo kayo ni siya, mga conjunctival, mga corneal foreign bodies. So this happens when certain dust particles or some material get into the eye. Patients, no, usually experience tearing, eye redness, eye discomfort. And then kaning mas serious ni ang corneal foreign body, no? Common ni siya, no, ayo sa mga tao doing construction or hardware work or kanang ang trabaho with metal grinders. Kunya wala nagsulog og mga protective goggles. So usually this is what happens. Sometimes kaning mga foreign body, after a few minutes of washing your face or your eye with running water, matangtang na dahil ni siya. However, in some cases, they don't. So you need to see an eye doctor to have it removed. Especially if it's a corneal foreign body or kaning naay foreign body or naay napuling sa samin-samin sa mata. Kailangan gina siyang tangon sa imong eye doctor. So if you have this case, you should go see an eye doctor because we have the equipment, the expertise to clearly visualize the foreign body to remove them safely. And then also we will assess for the damage and give you the appropriate medications. So it's important to remember, no, if you're working with doing carpentry work, magpanday, or kanang metal grinders, please wear your eye goggles. This is a very common na reason for consultation sa among OPD, no, mapuling. Kunyang kaning mga mapuling baya, kung mas lawom-lawom ang samad, mag-uwat ni siya. So it will form a scar on your cornea. So next, adto ta sa another very serious na ophthalmologic emergency, kaning corneal or scleral lacerations. So unsa man ni siya? So kaning corneal or your scleral lacerations is a very serious eye condition that happens after madisgrasya ang mata or certain accidents happen or na-trauma sa mata. We usually see this at our clinic after a patient gets hit by a nail, lansang, bildo, or certain sharp objects while gadua or gatrabaho. No, common kini siya sa mga bata, kanang dua-dua ng mga bata. Common pa din siya sa mga people in construction, kanang doing carpentry work, magpanday, ano siya. So kaning corneal and scleral lacerations is a very serious eye condition, no, that needs to be operated on as soon as possible. So kailangan ni siya operahan. Most of the time under general anesthesia ni na surgery. So kapag katulgon ng pasyente, unya ang samad kay limpyohon, tahion ang samad. Okay? Vision can be restored depending on the extent of the injury. Unya mo depend po ni siya kung naay ubang structure sa sulod sa mata na affected. Kay usahay dili man ang cornea or ang samin-samin sa mata or kaning puti sa mata na gisi. There can be some damage also inside the eye. So if mas grabe ang damage pod sa sulod sa mata, mas the visual prognosis or the chance for you to recover your very good vision also is less likely. Also kung mas dako ang samad sa cornea, unya naapod jud sa sentro, even if we do the surgery, unya maayo na, mag-uwat mo gud ni siya, okay? It will cause scarring on your cornea. And as you recall, when in my first slide, we discussed how the eye works, the anatomy of the eye. Ang kining cornea has to be clear. Dapat tinaw ang samin-samin sa mata, kaya di man mo aging suga. So imbis matahi ang samad, mag-uwat mo gud na siya. So there will be some blurring of vision, especially if ang samad na gud sa sentro, no? that will cause lifetime na blurring of vision unless mag-corneal transplant, pwede na natin mo discuss na karon. It's just important to note that this is an emergency that needs to be treated and needs to be seen by an eye doctor as soon as possible. So to avoid this, let's make sure na mo suot ang mga protective na equipment, no? If magpanday, make sure mag-goggles, make sure we child-proof our home para dili kani mga sharp objects, ang mga lansa, dili maigo ang mga bata. So, lastly, let's discuss on keratitis. So, kaning keratitis, muna mo tawag na infection sa samin-samin sa mata, no? Kung tanaw ka sa picture, kita makasamin-samin sa mata, nakita ka na naimurag puti sa samin-samin sa mata mo na that's what they call your keratitis, or an inflammation, an infection of the cornea. Okay? There are very many types of keratitis, pero ako i-discuss karon ang kaning infectious or ang keratitis caused by viruses, bacteria, or mga fungi, ana. Okay, so this is a very serious eye problem also. Usually mo happen ni siya if a patient kanang mapuling ang mata o nadili matambalan ng tarong, so it develops a bacterial infection or a fungal infection. Common siya sa mga karpentero, mga farmers, mapuling with soil or maiguog kanang branch sa tree. So this is if not treated properly, this can be a result, no? You can see the kaning puti sa mata, muni ang kagaw sa samin-samin sa mata, nakita ka na yung puti sa ubos mo ning nana sulod sa mata. Okay? Keratitis is a very serious eye condition. So it really needs to be, you have to be seen by an eye doctor and you have to be treated appropriately. Okay? In a lot of cases, maayo raman ni siya. Pero in some cases, good. Kung grabe na kaayo, dili gid siya matabang og ang tambal, kailangan ni siya operahan. Okay? There are certain eye surgeries that we do to make sure na dili mabuslot ang mata. Kaya ang kining kagaw mong god mo, this invades your corneal tissue, so magtikanipis ang samin-samin sa mata hangtod mabuslot. Okay? So if that happens, then that can lead to very serious sight-threatening, even life-threatening conditions. So keratitis. So if you basin maglibog mo, no, like doc, kaning piska to keratitis, maolagi siya naong, lahi man na siya. Kaing keratitis, sakit kay ni siya usually. Kaya ang piskat, wala man na, katol, sambol, puwa, ang kani, lahi man ni siya. Tanaw ka sa samin-samin sa mata, makita ka na nanay, di pa rin siya, nay puti sa samin-samin sa mata, niya red kayang mata, niya nana sa sud, niya pasyente, hanap na kayong pananaw sa pasyente. Okay, in keratitis. So again, if you have these conditions, make sure you go see an eye doctor as soon as you can. Ang common risk factors in keratitis, no, is kanang pong wearing of contact lenses, or kanang magpatakar ang patulog tambal, kanang wala na prescribed sa doktor. You just put in any medication on your eye. These are common risk factors of your keratitis also. So make sure mo avoid ana. Ang kaning contact lens, pwede naman ka mo contact lens, okay? As long as tangtangon mo siya ining gabi, okay, you have your appropriate medications given by your eye doctor, then okay ra na siya. So next, let's go to napalita yung mga picture sa keratitis. So muni ang kaning green, muna siya. Okay. So now let's go to some common eye misconceptions.
Hi everyone, good afternoon. I'm Dr. Joseph Viray, usapod ka resident doctor of Cebu Velez General Hospital. Kauban ko ni Dr. Martinez, and I'd like to continue sa sunod na parte sa atong diskusyon today. So I'll be discussing briefly on some common eye misconceptions that we encounter in our clinic. And after the lecture, there will be a question and answer portion. So if you have any questions, you may type them in the comment section below and we will answer them for you. So common eye misconceptions. First is kaning mga ultraviolet lamps. that are now commonly used in our household or offices. So lately, there have been an increase in the number of mga patients na magpakonsulta bahin sa constant exposure sa UV lamps. Makaepekto kini sa cornea or sa minsamin sa mata, mahimo kini makadaot if dugay nga exposure without mga protective eyewear. Makapurma ni o gagmay nga garas-garas agi sa init sa UV light, pagpula sa mata o pagluha-luha. So angay nga magpatanaw sa doktor para ma-examine ang mata kung mabatian ning mga simptomas. So always remember to wear your protective goggles when handling these equipments. So sunod ang atong paggamit sa mga gadgets, so labi na sa new normal, karon nga kasagaran online ang pagtrabaho and paggamit sa eskwela, so mostly sige ta og gamit og mga gadgets, cellphones and computers. So kini mo mga angay masayran ang epekto sa blue light sa atong mga mata. So ingon nila makadaot sa mata ang blue light nga gikan sa screens. Ang tinuod is dili ang blue light nga gikan sa mga screens ang tantong rason nganong madaot ang mga mata. Ingon nila ang blue light ay hinungdan sa kakapoy sa mata. Ang tinuod, ang kakapoy sa mata kay tungod sa paggamit sa mga devices ug dili lang sa blue light. Ingon pud nila makatabang sa tarong sa pagtulog ang mga anti-blue light nga antipara. Ang tinuod, makabati og tarong nga pagtulog kung ang bawasan ng pag-atubang sa screens matag gabii ug dili lang sa paggamit sa usa ka klaseng antipara. Ingon pud nila makatabang ang anti-blue light nga antipara sa kahimsog sa atong mga mata. Ang tinuod is wala pa ang napamatud-an ang adunay maayong epekto ang anti-blue light nga antipara sa kahimsog sa atong mga mata. So unsa may angay nga pangbuhaton, so ang tambag sa mga eksperto is dili magpalabi og atubang sa mga screens, bawasan ang oras nga nakatubang sa screen matag gabii, ipahulay ang mga mata kanunay sa pag-atubang sa screen, pahinayan ang kahayag sa mga screen, ug dungagan ang lawasong kaliukan matag adlaw. So next is we have our digital eye strain. So unsa maning digital eye strain? So ang uga sa mata, ang tubigon nga mata, ang sa paghanap sa pananaw. So unsaon ang mga pamaagi malikayan ang digital eye strain? So taro nga postura nga dapat na sa eye level ang pag-atubang sa ang computer ug turungon ang postura sa paglingkod. Ayaw kayo ipaduol. So ipalayo og 18 to 24 inches ang cellphone gikan sa imong mga mata. So padak-an pod ang letra. Ipahiyangay sa komportable nga level ang kadak-on sa mga letra sa screen. Ang kahayag sa screen. Ipahingayan sa komportable nga level ang kahayag sa screen. Ang 20-20-20 rule. Ipahulay og 20 ka segundo ang mga matang 20 ka minutes pinaagi sa paglantaw sa 20 feet palayo sa screen. Then pagpirat-pirat sa mata. Angay na ipirat-pirat ang mga mata kay kini makatabang sa pagdikay sa pag-uga sa mata. Next ang pagpalayo sa hangin. Ipalayo ang mata sa direktang pagbuga sa hangin gikan sa mga electric fan o aircon para malikayan ang pag-uga sa mata. Ang patak para sa mata. Angay na mo gamit og lubricant, eye drops kung magpakabati og pag-uga sa mga mata apan ginawang ang makonsulta uban sa doktor bahin ani. And always, if symptoms does persist, always consult your doctor. Ang last is mga angay nga oras para sa screen time sa mga bata. So sa edad nga 1-year-old, walay screen time. Ang mga bata edad 1 pababa, dili angay mo gamit og mga digital devices. For 2 years old, di mulapas og 1 ka oras kada adlaw. Ang mga batang edad na 2 anyos, angay lamang mutanaw og kalidad nga programa, di mulapas sa 1 ka oras ug naay pagbagda sa tiguwang. So around 3 to 4 years old, dili mulapas og 1 ka oras kada adlaw. So, importante ang pagdumala sa tiguang bahin sa mga oras nga pag-atubang sa screen sa mga bata. So, ginabawhag nga nga ipasikat ang mga kalihukan para sa physical ug mental nga kahimtang sa bata. So above 5 years old, gidumalaan nga oras sa screen. Importante ang magdumala sa tiguwang bahin sa screen time sa mga bata o ginaahag ang kanunay na pagpahulay sa mga bata aning mga screen or devices. So that ends our discussion. Salamat sa kaninyong tanan sa pagpaminaw. Hinatunta na naamoy nakatunan bag-o karong adlaw. So next will be our question and answer portion. Just write your question and comments and we will happily answer them for you.